Entrepreneurship, jointly organized by Department of Microbiology and Fermentation Technology and BioNEST Incubation Center, CSIR-CFTRI, Mysuru. Today, we gather here to celebrate the convergence of research, innovation, and entrepreneurship in order to explore the immense potential of microbiome-based solutions, be it probiotics, postbiotics, or fermented foods. We extend a warm welcome to our director, chief guest of the day, speakers of today's event, industry participant, science and technology staff of CSIR CFTRI, research scholar, and students who have joined us for the event in person and online. I request the dignitaries, our director, Dr. Sridevi Annapurna Singh, chief guest of the event, Dr. B. Sasikiran, former director, National Institute of Nutrition, and Dr. Ninad Pandit, manager, R&D, Zytex Biotech Private Limited, Mumbai, to occupy the dais, please. I also request Dr. Prakash M. Halami, chief scientist and head, Department of Microbiology and Fermentation Technology, to accompany the dignitaries to the dais. Thank you, ma'am, and thank you, sir. We shall now begin the program with a serene and auspicious note. I would like to call upon Miss Prachi for an invocation song.
या कुन्देतु तुषारहारधवला या शुभ्रवस्तावृता या वीणावरदण्डमण्डितकरा या श्वेतपद्मासना या ब्रह्माशुद्धशङ्करप्रभृतिभिः देवै सदा वन्दिता सा मा पातु सरस्वती भगवती निशेषजाड्यापहा. Thank you.
Thank you very much, Prachi, for the soulful rendition. A traditional lamp lighting is a symbol of igniting and spreading knowledge, wisdom, and positivity. I now request our esteemed dignitaries on the dais to come forward for lighting the lamp. Thank you very much, ma'am and sir. Um, I request, yes, sir. I now request Dr. Prakash Halami, sir, to welcome the dignitaries on the dais with a flower bouquet and to deliver the welcome address. Please, sir.
Good morning, everyone. Dignitaries on the dais, participants of this network meeting. I am very happy to welcome you all for this network meeting on probiotic, postbiotic, and fermented food-based startups and entrepreneurship. Today being held at CSIR-CFTRI in collaboration with our BioNEST, which is located in CFTRI. As we know that the food market is one of the most important segment in world economy, and today there is realization among consumers for healthier lifestyle because the consumption of the functional food is very important with reference to their positive health benefits. The balanced nutrients that credited with the reducing the risk of several metabolic diseases. In parallel, there is a growing awareness about the gut health, which plays a crucial role in maintaining a good gut microbiome also, and that starts from each and individual microscopic entity that live in our GI tract. The food product which promotes digestive health, provide immune support added with the nutritional and enhancement occupies important place in functional food development. And as we see that the functional food market today is almost 400 billion US dollar and estimated to be almost double by 2030 with a growing CAGR of 10%. Among functional food, the probiotics that was actually or at least 80 billion US dollar in last year and is projected to be 120 by 2030, almost with the compound growth rate of 8%. Similarly, the postbiotic now being spoken widely these days because probiotics, once we say it is a living organisms and with a definite numbers, postbiotics deviate these two things, the soluble material from the grass or the probiotic microorganisms which we use. Also picking up a very good market size these days, and that is actually at present 10 million US dollar. It was last year. On the other hand, the fermented food, which we are actually minimizing to consume, but if you see in the Western world, they are almost consumption of 200 gram per day. Okay. As such, the total consumption of fermented food in our intake is 20%, in the world. And fermented food actually helps not only providing the useful microflora, but the metabolites, which are produced during the fermentation, enriched with several bioactive substances, and has also a very good global market these days, almost 1,000 billions. Today we have for this event with us Dr. B. Sesikiran, former director, ICMR, National Institute of Nutrition, and former member, Research Council of CSIR-CFTRI. He is presently associated with several regulatory organizations in the country like FSSI, and also of course with the funding agency with the government of India. I have a close interaction with him, especially particularly with reference to the Gut Microbiota Foundations, which we had recently, the 15th one in the PGI Chandigarh. And of course, he is also Vice President of Probiotic Association of India. And as well as we interact very regularly with reference to the activities of International Life Science Institute, where he is associated with formulating the guidelines for this probiotic as well as postbiotics and the functional food. He will be addressing us shortly as a chief guest on the topic Microbes for Good Health, the paradox of healthy living. On behalf of everyone present here and my behalf, I request our director to welcome Dr. Sesikiran for today's function. Thank you, madam. Thank you, sir. Dr. Sridevi Annapurna Singh, dynamic director of this institute, is known for several her research activities in the protein chemistry and technology, as well as transferring the technologies, especially pertaining to the malnutrition. She is backbone of several of our activities in the institute and of course for this network meeting also. With her visionary leadership in R&D activities, especially with reference to combating the malnutrition in the country with the several intervention programs, and also in the innovative ideas which we have seen in 1 week, 1 lab program, as well as now the Platinum Jubilee celebration, which is being there, and of course the recently concluded Millet Mission projects. I take this opportunity to welcome on behalf of every one of you and my behalf to Dr. Madam. I request Dr. Giridhar to welcome with the flower bouquet. Thank you. Though this event is actually no registration fees for the participants, but then this still organizing event like this requires the financial assistance. And then financial support, I am very happy that the GTEX Biotech Private Limited Mumbai wholeheartedly came forward to support this event. GTEX Biotech Private Limited is a research and has a research and development activities in Mumbai and production facilities in Baroda, Gujarat. GTEX is a leading probiotic company in the country. And Dr. Ninath Pandit, a postgraduate and doctorate from UDCT Mumbai, is with us, who will be also delivering a lecture on probiotic research in GTEX Biotech shortly. On behalf of every one of you, and on behalf of the organizing committee, I welcome Dr. Pandit. I request Director Madam to welcome with the floor. Thank you. Backbone of this network meeting actually is Dr. Sri Lakshmi Desiraju, the CEO and co-founder. I think she is on the way perhaps, because day before yesterday when I told her that we supposed to meet yesterday evening, and then she told that she is traveling and directly she will be coming. So I take this opportunity to welcome her. Beside the two speakers, one is from industry, Mr. Kumar Shankaran is there. I think they are also on the way from the Lucin Bio Reach Bangalore, and Dr. Supriya Mahesh. She is also, we expect, is on the way. I take this opportunity to welcome all these three people. Actually, in this network meeting, we have a session called Research Academia Connect, wherein well-known research from academic as well as research institutes will be requested to share their knowledge. And this session will be after the post-lunch. To share their knowledge to get connected with the startup and entrepreneurs in the area of this today's topic. And in this research academia, we have Dr. Ram Kulkarni from Symbiosis. If you can stand, I think it will be much better. Pune, then Dr. Syed Dastagar from CSIR-NCL, Pune, and then Dr. Radha Krishna from Satyabhama University. Then Dr. Indranil Chattopadhyay from Central University of Tamil Nadu. Then Dr. Ponga D. Vijay Kumar from Periyar University, Salem. She has already arrived, but I think she's just on the way, I think, from the guest house. And several other dignitaries, I think she is here. Dr. Pongadi Vijay Kumar. Please come, madam. You are welcome. And of course, our senior colleagues from the department as well as from my society, Dr. Hasna Uruz is there, Dr. Venkateshwaran, former head of this microbiology department. One of the, besides, I welcome all for this event. One of the important session of today's event will be a panel discussion wherein Dr. Sri Lakshmi Desiraju will be coordinating the session, and lead speaker will be Mr. Kumar, which I was just referring. Then Sri Priya, Dr. Ashutosh Inamdara, TTBD head. They will be addressing the queries, and Dr. Swaranjit Singh, a former chief scientist of Intech Chandigarh, he will be joining online. So I welcome them also. We received actually somewhere 220, 230 registration, and among them I think somewhere 50 are online. So I hope they are I have joined already. Then we have actually the entrepreneurs from the Himalayas. The colleagues are here from Himalaya, as well as Mr. Ramesh from Guru Kiran Beverages. Yes. And several others, they are also on the way. Actually, I take this opportunity to welcome them. As you know, that this event is organized in collaboration with the BIRAC-BioNEST of CSIR-CFTRI and Dr. Vikas Singh Chauhan. He has helped us a lot, the coordinator, as well as Mr. Pawan Kumar. Pawan Kumar is a little bit in a long distance from us, so I welcome along with his team from the BioNEST for this event. I also welcome the delegates, those who are actually showcasing their product. So we have received somewhere 20-25 entries to display the products, which will be just before the lunch break. So you can actually try to taste also or just have the observation, and I'm sure that that will be a really very interesting session, which will be just in this quadrangle. I also welcome the staff of Microbiology and Fermentation Technology department. I just would like to let know the audience that the Microbiology and Fermentation Technology department was judged as one of the best R&D department in the institute last year. My team of organizing committee, and of course the online and the offline delegates of the sessions. Just to wrap up, the fermented food, such as the Bulgarian fermented milk, that was credited to improve the longevity of life, as suggested by Elie Metchnikoff in 1908. We are in fact revisiting his hypothesis through the science of probiotics, postbiotics, and designed fermented foods. As an organizing secretary of this event, I am sure that the confidence and of this networking will be a real story, success story in the area of functional food among academics, researchers, and startup entrepreneurs. I once again welcome everyone present here online as well as offline. Thank you very much.
Thank you very much, sir. I now request our director, Dr. Sridevi Annapurna Singh, to welcome Dr. Prakash Halami with a bouquet. Thank you very much, ma'am. We are deeply honored to have with us Dr. B. Sasikiran, former director of National Institute of Nutrition, who will be delivering a keynote address on the most relevant topic, microbes for good health, a paradox of healthy living. For better understanding of the subject that beautifully captures the equation to strike a balance between modern lifestyles and traditional wisdom, the powerful role of microbes in maintaining health. Sir, we are truly privileged to have your presence here, and we now request you to come forward to deliver keynote address to the gathering. Please, sir.
The slides. Good morning to everybody, and at the outset, I would like to thank the director, Dr. Sridevi Annapurna Singh, for inviting me to this prestigious institution. It has always been an honor to come to this place, and I also thank Dr. Prakash Halami, who has been doing pioneering work in this particular field and is now in the process of disseminating the knowledge to others so that you can go forward and through your enterprise translate this into benefit for the consumers. The topic of probiotics was nothing new to India because in Ayurvedic science understood this because Ayurveda always stressed that a person's digestion is probably the most important element to keep one healthy. And they said that most of the diseases came from the gut. And even Hippocrates in 460 BC said that all diseases and death originate from the gut. So they didn't understand what they meant, so they called it as digestion. But we now understand that it is not actually the digestion, but the presence of trillions of bacteria in the gut, which keep not only our intestines healthy, but also the whole body functioning properly. And the paradox here is that we have now reached a stage when we are trying to use bacteria to fight bacteria. Because we know that most of the diseases in the world have been due to infectious diseases earlier caused by bacteria. And now we have a set of bacteria which are now being used to control those infections. It will probably replace antibiotics in the near future. The gastrointestinal tract is the largest place where the largest number of bacteria exist, even though other parts of the body, including the skin or the oral cavity, the respiratory tract, are also having a lot of gut bacteria. In fact, there is a new area where people are using probiotics for cosmetic purposes because they realize that you can actually improve skin health by introducing these bacteria in the various cosmetic products which people use. So the goals are many, but we'll confine ourselves only to what happens in the gastrointestinal tract and through food. Now, the important reason why bacteria are located in the intestine is because 70% of our immune cells are also located in the intestine. And so the primary function of the bacteria has always been understood that it is meant to promote our immunity, and that is how it protects us from various diseases. And these immune cells are constantly communicating with the bacteria which are inside the lumen, which means that if we have the wrong kind of bacteria, our immune system will also go the wrong way. So the probiotics science itself is intended primarily to enhance immunity. You see many products which contain these probiotics saying that it's immune, it improves your immunity and so on and so forth. These bacteria in the gut have got several functions. The one on the extreme left, of course, is to protect us from the harmful bacteria. This they do by simple numbers. When you have lots of trillions of bacteria sitting there occupying the entire mucosal margin, they prevent the bad bacteria from taking a foothold and entering into our system. So that's the protective function. And as I already mentioned, they also enhance immunity. And in recent years, we found that these bacteria are not just simple passengers in our body, but they also have an active metabolic function. And that is the metabolic function which Dr. Halami and his colleagues are trying to harness to give us human benefits. So what they do is they produce a lot of substances. They ferment the fiber and produce short chain fatty acid, which is also a source of energy. And it keeps the intestinal cells healthy. And many other vitamins, some of them, of course, are not bioavailable for us. But the new information which we have now is that they also produce neurotransmitters, which are basically chemical signals which the brain communicates within the brain and from the brain to rest of the body. The question now is, why should a brain chemical be present in the intestine? So this has led to the concept that probably the intestine is a second brain, in the sense that the intestine also communicates with the food and the other components which enter into the gut, and through them it sends signals to the brain. This may also be associated with signals like appetite signals and other things which are related to our consuming food. But it is also known now that they are related to neurodegenerative diseases. There are a lot of new ways where they are planning to use these products or the bacteria which produce these products in the management of diseases like autism, Parkinson's disease, senile dementia, and other neurodegenerative disease for which modern medicine till date has no definitive answer. And with an aging population, here there is a lot of promise that probiotics and their products, which we now call as postbiotics, may have an important role in managing these kind of painful diseases. Now, there are several diseases which are now definitely can be mitigated with use of probiotics, like inflammatory bowel disease, in some types of prevention of progression of metabolic syndrome, and other infections and so on. So these are the ones which are already established, and even in allergy, we find that there is a lot of scope for the use of the right kind of probiotics to alleviate these allergy symptoms. Now, how do these probiotics actually get into our intestine? Are we born with this bacteria or not? Here again, exciting new research shows that the first dose of bacteria, which are most often bifido or lactobacilli, comes from the mother through the breast milk. And this is happening because the mother's gut bacteria somehow migrate to the mammary gland in the last days of pregnancy, so that these bacteria are consumed by the baby through the first dose of breast milk. Not only that, they also found that bacteria migrate from the mother into the birth canal. And so they are somehow, that function is still not clearly defined as to why these bacteria are present inside the womb itself. Well, while we all the while thought that it is a sterile environment. And based on this kind of knowledge, now physicians are thinking whether if you give probiotics to mothers during the last trimester of pregnancy, the good bacteria, will these good bacteria find their way into the baby and therefore give the baby the protection? So there's a role for probiotics as well as prebiotics in the management of early infancy and neonatal period. There is also enough evidence to show that the immunity of a baby born through the natural way is much better than the immunity of a baby born through a cesarean section. In fact, we are now using this as a way to propagate to the various obstetrician to avoid doing a cesarean section as far as possible, because the baby's immunity is suboptimal if it is born by cesarean, at least for the first few days till the breast milk starts protecting the baby. And of course, our entire health is dependent upon a balance of the positive bacteria versus the negative bacteria, and any kind of an upset of this balance towards the negative side, we call it as dysbiosis. Now, each of these donut-like rings represent the numbers and the type of a particular family of bacteria, and you will realize that there are a range of different bacteria. It is not single. And we also know that bacterial diversity is needed for health. So it is wrong to think that if you keep on taking probiotics and colonize your gut with one type of or a couple of types of bacteria, we will be healthy, which is not true. You need to have the wide range of bacteria because each type of bacteria has one type of function. They are strain specific. So when you market a particular probiotic, you should be clear of what strain you're using, and you should see what does the science say about that particular strain, what benefits. So you cannot make a claim of a particular health benefit if it is not relevant to that particular strain. So monotony of gut bacteria is not what we are intending to say. Even clinically, when you're treating a patient post antibiotic diarrhea or a post diarrheal loss of the gut bacteria, we only provide these bacteria for a short period. There are studies done by this on Lactobacillus shirota, which said that as long as you keep on giving, you must have heard of the common product called Yakult is there. So Yakult Research Institute has done a study that you keep on giving them for, let's say, several months, then you discontinue. Within 1 week, that particular strain of bacteria disappears from the gut. So that means you cannot locate it from the fecal matter. So probiotics are always a temporary solution to any of the health problems. They can never be like, for example, we keep popping vitamin pills all our lives, thinking we need it. In the same way, we cannot continuously be taking probiotic. So how do you maintain the good bacteria? It is through proper diet. You provide the right kind of substrate for the right bacteria and the good bacteria will grow. You provide the wrong kind of substrate like high sugar containing food, then the bad bacteria will grow. So our diet is the primary method by which we can manage the bacterial colonies. So there are various ways by which you can modulate the bacteria. One of them, of course, by giving probiotic, but more than anything else, it is through normal diet and a healthy lifestyle. The clinical evidence of benefit of using probiotic bacteria in the management of disease is only in some entities, like in infants in necrotizing enterocolitis and infantile colic. Some of the bifidobacteria strains are known to reduce. Babies sometimes scream their head off when they're during the first few months of their life because they have colicky pain. And I remember those days we used to give gripe water for children, to prevent that colicky pain. But subsequently, pediatrician found that it doesn't work. But certain probiotics are known to now reduce infantile colic, and that is well established. And some formula are now containing these probiotics. We also have acute infectious diarrhea whenever a person has got a gastroenteritis because of bacterial gastroenteritis. At that time also, after antibiotic treatment or after diarrhea, probiotics are known to benefit. They are known to benefit in traveler's diarrhea. And of course, quite a lot of inflammatory bowel disease like ulcerative colitis, irritable bowel syndrome, and many of these, and including some of the vaginal infections. Through probiotics are not only through the oral tract, but also through the vaginal tract. They manage a distressing problem called as bacterial vaginitis, which is very common among women, can also be managed. So these are several clinical situations where probiotics are being used. And you should remember now, coming to regulation, if you have a product which has got probiotic, if it is through a food base, you go to the Food Safety Authority for your regulation. But if it is in a capsule or tablet form, then it has to be the drug authority who will give you the approval. So inflammation is now one of the common factors which are responsible for us succumbing to various diseases, including diabetes or heart disease, etc. And this inflammation occurs through the mechanism through the gut. If we eat the wrong kind of food and the wrong bacteria are there, these bacteria cell walls get into the immune system. And the immune system thinks it is an infection and it produces a whole lot of inflammatory cytokines. Since there is no infection, these inflammatory cytokines stay on in our body. And when you look at the inflammatory markers like HSCRP or cytokine levels, if you look, many of us have a high inflammatory score. Those who have higher basic inflammation are likely to develop several diseases, including cardiovascular. And we saw during the COVID epidemic, the people who had higher baseline inflammation had severe morbidity, hospitalization, and even death, whereas people who did not have that inflammation survived better. So that is why they used to do this HSCRP, C-reactive protein, high sensitive C-reactive protein as a marker of inflammation. Probiotics are known to help in reducing this inflammatory challenge in our body. and thereby indirectly benefiting the health in preventing so many other diseases. Even insulin resistance is known to start off because of a higher inflammation. So this is an example. If you see the cascade, you have a high fat diet. When you take a high fat diet, the intestinal permeability increases. In the sense, normally the intestine does not allow anything to come through except the nutrients. But if you have a high fat diet, the intestine sort of become a little loose, like a sieve, and several negative things get into the blood and cause inflammation. So that is the LPS, is a bacterial lipopolysaccharide entering the circulation. They in turn cause tissue inflammation. When the tissues get inflamed, the insulin doesn't work, so they develop insulin resistance, and that leads to metabolic syndrome and all the other consequences. So not only the high fat diet, but also the appropriate right kind of bacteria, if they are present, we can minimize this problem. This was the gut-brain axis which I was telling about. Several metabolites like epinephrine, norepinephrine, and serotonin, gamma-aminobutyric acid, all neurotransmitters which are normally present in the brain, are being produced by these bacteria. And we should also know that there are several thousands or millions of neural cells located along the gastrointestinal tract. These are the neural cells to which the brain communicates through the vagus nerve. We often know that when you are under tension, when you are under stress, going for an exam or facing a big challenge, we often have higher bowel movements. Okay, you tend to visit the toilet quite often, even though there's no infection. And that is because the stress in the brain is being transmitted to the gut. Now, the same neurons also now reverse transmit to the brain. So if you are having a healthy gut, it tells the brain to act to de-stress. So these neurons seem to have a communication, and that is how the idea that this may be also related to neurodegenerative disease has come up. So this is some research on autism spectrum disorders. They found that the gut bacteria in children who are autistic or suspected to be autistic is totally different from that of the normal children. They do not know whether this is the cause or the effect, but by modifying the gut bacteria, they found autism symptoms seem to be getting better. So autism spectrum disorder is now one of the targets. A lot of research is going on. It's a matter of time when drugs or probiotic-based drugs will be available in the market for mitigating this. Not that we won't say that they'll completely get over this, but probably it's become one of the tools for managements. And this is on patients having Alzheimer's disease. They found that the spouses of patients who had Alzheimer's disease, if you leave them alone over a period of time, they will also develop symptoms of Alzheimer's disease, because the gut bacteria in patients with Alzheimer's disease is of a peculiar composition. And since within the family, the gut bacteria more or less remains the same, the spouse also has the same kind of a gut bacteria, which has been shown further that the risk of a spouse developing Alzheimer's disease several times higher than in a person who does not have an Alzheimer's disease patient at home. So now that again has boiled down to the gut bacteria, and therefore it can be modifiable. So they also found that in psychiatric illnesses, when they were treating with many of the antipsychotic drugs, what is called as selective serotonin reuptake inhibitors, when they gave it with the probiotics, the mental health of the particular patient improved tremendously than when they gave without probiotics. So there is an interaction between the psychiatric drugs and also the gut bacteria in facilitating through the gut-brain axis a better brain function. So all evidence therefore suggests that in some sense, the gut microbiota can be seen as an additional hallmark of human aging as well. So healthier the gut bacteria, aging can also be delayed. And in fact, the Japanese are doing a lot of work in that area because aged population is a problem there. And there are also gut bacteria composition may be indicator of a preclinical Alzheimer's. So you can even look at the gut bacterial composition and predict whether the person is going to develop Alzheimer's disease. So it's also becoming a diagnostic tool. Then come to the antimicrobial resistance. So we are increasingly having resistance to antibiotics because we are indiscriminately using antibiotics. For a common cold, most people on the first day or the second day itself go for the highest end cephalosporin antibiotics, even though it's not bacterial, it's only viral. As a medical professional, I am not able to convince my own family members not to take antibiotics when they have cold. So they overrule me and say, no, especially if it's a child, you cannot prevent them from giving antibiotics. The moment the child sneezes twice, the mother immediately puts on antibiotic. This leads to antibiotic resistance or antibiotic. What happens is the gut bacteria are constantly having exposure to these antibiotics, and by a natural process of mutation, they develop antibiotic resistant genes. It is fine as long as it's within the gut bacteria. The problem is they pass on the resistant gene to the pathogenic bacteria when it comes. And I very often find that in the intensive care units and the acute medical cares and hospital, doctors are frustrated that when the patient develops a lung infection or something, none of the antibiotics work. And somebody develops a urine. Any of you have ever recently seen a urine culture report? If you do a urine culture report, urinary infection, you now find out of a list of 25 antibiotics, 20 they'll be resistant. So this is a visible evidence that antibiotic resistance is increasing. And apart from that, the veterinary science and the veterinary through poultry and cattle, they're using antibiotics. And when we consume these foods, we also get exposing our guts to that antibiotic and therefore developing antibiotic resistance. Now, even Dr. Halami's work I was discussing yesterday, these postbiotics are probably going to be replacing the antibiotics in a matter of time because they have got very similar property, antibacterial property. That's what I meant by saying using bacteria to kill bacteria. Then we come to functional foods. So these are foods which actually help the gut grow better bacteria. They have a good gut microbiome. And these may be probiotics alone or probiotic foods, or they may be prebiotics containing the right kind of dietary fiber. So there are several common foods actually are act as prebiotic. We need not even go for a commercial prebiotic, or one could prepare a commercial prebiotic with a concentrated form of this. For example, chicory has got inulin, which is one of the most potent prebiotics. And of course, garlic and onions, which we take every day. Bananas with inulin and resistant starch. Barley and oats with beta-glucan. Apples and pectin. And you see a whole lot, and wheat bran, in fact, arabinoxylans, oligos. I think here in CFTRI also there are some scientists working on arabinoxylans, which comes from wheat bran. All these, and of course, human milk itself has got prebiotic, which is called as human milk oligosaccharide. And there are a whole lot of foods which we call as FODMAP foods, which are fructo, oligo, di-monosaccharides, and polyols. And these are present in a whole range of, so our standard Indian diets are already having enough probiotics. So that's why we feel that if we had traditional diet, we don't need to have any of these other supplements. But since we have moved away from traditional diets and we are now going in for high refined foods, which do not have much fiber, and our children are also seen to be getting addicted to these foods, their guts are going to have the wrong kind of bacteria. So we need to either shift to the traditional food or develop foods which have these particular ingredients. So functional food, therefore, if you go clockwise, could be probiotics or fermented food with natural probiotics. Or it could be food in which you add probiotic, then it becomes a fortified food. Or you could have a purified probiotic as a dietary supplement. So the various ways by which you can deliver the probiotic. So the closer you come here, it becomes more like a medical application, whereas all others are all based on food applications. Then you could also have from top, you see prebiotics. These may be coming through our natural food or purified fiber or fiber as a dietary supplement. So there are various ways we could actually develop products. There are various ways we could address the healthy gut. Now, what are the prebiotic characteristics? Prebiotics are basically non-digestible food ingredients. Okay, and they are mainly oligosaccharides. They stimulate the growth of beneficial bacteria, and they should be resistant to gastric and intestinal digestion. Just as we say probiotics should be resistant to intestinal digestion, prebiotic also, they shouldn't get digested in upper gastrointestinal tract itself, because they'll never reach the lower GI tract to give the benefit. And they should be fermentable. The gut bacteria should be able to ferment them and generate the various postbiotics. See, oligosaccharides are the galacto-oligosaccharides which are present in milk. That is, the human milk has these human milk oligosaccharides, which are specifically the substrate for bifidobacteria, which is the commonest kind of bacteria that grows in the infant gut. That is why we say, as long as you exclusively breastfeed a child, the child's gut health will be very good. The moment we shift over to some artificial foods which have high sugars and so on, then these bifido will go away. So the galacto-oligosaccharides can now probably also be synthesized and then can be useful to the adults as well. There are non-starchy carbohydrates also act like inulin, like cellulose, dextrins, chitins, etc., which are most of it we actually discard. In fact, many products can be made with the discarded products in other industries. And these compounds are also found in cereals, nuts, and so on. And they are partially susceptible to bacterial fermentation. And they also improve bifido as well as lactobacilli and improve gut health. And then polyphenols. Polyphenols are also present in many of our foods, and polyphenols also act as a substrate. But what is more important is the polyphenols which we take. It could be anything like resveratrol or tea polyphenols and so on, or soy polyphenols like genistein, etc. They are potentiated or become more bioavailable by the action of the gut bacteria. So the gut, just taking a polyphenol will not give you a benefit if you don't have the right kind of gut bacteria. So they are better absorbed and they stay in the plasma. And when they are getting absorbed, these polyphenols also reside in the plasma for a longer time, giving us the benefit of the polyphenol. So they found that the soya, when you take soy polyphenols to eat consuming soya, the Western population did not get the right kind of benefit, in the sense that many of the polyphenols didn't act that well in the Western population, but they acted very well in the Eastern population. They went on to see that some of the gut bacteria actually convert these genistein and daidzein into another compound called equal. So the Eastern population have good such kind of bacteria, we produce equal, and therefore that equal was the one which was giving the benefit and not the genistein per se, which the Westerners didn't have because their diets were different. So our traditional diets were not only good for the bacteria per se, but they are also good for the polyphenols to be better bioavailable when we consume them through natural foods. So resveratrol is also which is present in grapes and wine, is good for bifidobacteria. Anthocyanins, which is also inhibit the growth of some of the harmful bacteria like Helicobacter pylori, which is a common gastric bacterium. And T catechins also have been shown to modify the mucin content and then help better, could modulate bacterial adhesion. So many of these phytochemicals have action on benefiting the gut. And many of the phytochemicals also get further enhanced in their action by the gut bacteria. So there are two-way kind of a process. We now come to postbiotics. I think Dr. Halami may be a better person to talk on this. We always had one debate every time. Some people will say, is dosa or idli a good probiotic source? And most of us said, yes, they are traditional fermented food. They do have probiotic or yeast-like organisms which are beneficial. They'll be good. But then the question is, when you make the dosa or the idli, the heat will kill those probiotics, right? And therefore, probiotic effect won't be there. But now we know that even a dead bacteria, its cell wall is going to be beneficial. And probably dosa and idli still continues to give us the benefit of probiotic, even though there are no live bacteria. So the postbiotics are nothing but the non-viable bacteria, the cell walls, the proteins that they produce, and also the polysaccharides of the cell walls, the short chain fatty acids. And now a new science is developing of postbiotics, where you just culture the bacteria and probably heat kill. Is like vaccines. Many of our vaccines are actually killed bacteria. So here even a killed bacteria or dead bacteria or destroyed bacteria still gives the health benefit. Therefore, a lot of research needs to be done in this area before we develop these. But this is the definition. It's a preparation of inanimate microorganisms and or their components that confer a health benefit on the host. This is a slight modification of the definition of a probiotic. So these are the various postbiotic components. They could be peptides like bacteriocins. This is what I said probably will be the future of replacement for antibiotics. They could be cell surface components, exopolysaccharides, and many more. And what are the possible functions? They could be anti-inflammatory, and therefore we are talking about inflammation. This is one way of reducing the inflammation. They could kill bacteria, and therefore they have antibiotic-like function. They can have a hypocholesterolemic effect, immunomodulatory, and even insulin secretion and sensitivity. These effects have been shown through research on postbiotics. So that in summary is the entire chain of prebiotic, postbiotics, and as well as probiotics. So it is left to our imagination to translate the science into a product which will benefit the people. But one caution is that whenever we make a product, we are always tempted to make a claim. So you make a claim only when you've done a well-conducted study. And not only, even though the sales may get better with a claim, but claim should be backed up with good study. And you have a lot of science available. You can make an ingredient claim based on already published science. You don't have to do the study. You say my product contains X, which is known to give this Y benefit. Or if you want a product-based claim, then you have to do a study. And of course, institutions in the country, both in private sector and public sector, like CFTRI, NIN, etc., are there to do those kind of well-planned studies. In fact, I was told that I was trying to make FSSA have a regulation and the panel for helping industry do clinical trials in the right manner, because CDSCO does that. The drug controller actually reviews studies done on drugs, but food control does not do anything. But later on, when you make a claim, they complain. So instead of doing that, I said you should have an expert group which helps you do the studies in the proper manner, so that industry will know where to go over the study, how to design a study, whether it should be double blind, single blind, and so on and so forth. And that committee met yesterday, it seems. Dr. Kanungo is the chairman for that committee. And ILSI also, we did a workshop and developed the guidelines. And we hope that food industry will benefit out of that new regulation. So thank you very much for this kind invitation.
Sir, thank you very much for sharing your knowledge. And the talk was truly enlightening and engaging. The session is now open for any questions. So if anyone from audience have any query or would like to share a thought, please feel free to. Anybody? Yes, sir.
Yes, sir.
They will be clear for the grass, because now
at the moment in the list of approved probiotics in the regulation, gram negatives are not there. Yeah, but depending upon the availability of the science, it can be included. Any of the bacteria can be included at any time. So the list which is there is not a closed list. You can always add. The only thing we have to show the history of safe use.
Yes.
And its efficacy. And history of safe use is possible. That is one stumbling block, of course, is history of safe use. Now they say it should be at least 15 years. So any of the new innovations won't have that kind of history of safe use. So it has to be done on an experimental basis, generate a whole lot of clinical data. And on the strength of the clinical data, you can get it approved. But in the absence of clinical data, only history of safe, if it is used in another country for 30 years, you can use it, you can get it included in India.
Hello, sir. Nice talk. Thank you. My question is related to strain-specific features of probiotics. So the clinically used probiotics are known to have strain-specific features, whereas what we say, in fact, what you have also discussed in your presentation is, in general, the combination of various microorganisms is likely to offer more benefits. So having a specific strain, do you think it is a more like commercial strategy than the actual benefits, because the combination is likely to be better? What do you think? Thank you.
Yeah, actually, strain-specific benefits are not yet in part of regulation. Regulation, we don't have strain-specific benefit. In fact, many probiotic producers or manufacturers are now asking for strain-specific benefit, because you, with all your hard work and research, you develop a strain which has got a unique characteristic. Okay, let's say lactobacillus something, some strain, and then somebody else put the lactobacillus just without that strain or any other strain, but makes the same claim. So this has led to a lot of issues. So strain-specific claims will now have to be listed in the FSSAI, so that if you don't specify the strain, you can't make that claim. And only when you specify, you have to make that particular. That will probably has to come. And then this multiple strains, one advantage, you already have many in the market where they have multiple strains. The multiple strains is each one of them has known to have one particular advantage. So in a combination, they seem to be working better. It is something like our micronutrients. When you give a single micronutrients, you can never solve any particular problem there, because they are all interacting. So the interaction between the different strains gives a collective advantage than any one of them singly. But singly also they are effective. But your ultimate goal is to give a particular effect which is possible only by combination, which you generate through research, through your clinical studies. Provides. Yes.
Food ingredients.
Yes.
But whereas postbiotics and probiotics are isolation substances, does it have any cutoff values? Because when we talked about these things with the clinicians, what they talk about is how will we know that when it becomes overloaded? So when it has to be cutoff time for these two segments?
That is probiotics.
Yeah, probiotics and postbiotics.
Yeah, postbiotics, we still don't have that kind of information. It depends upon, there are a whole range of postbiotic. Like, for example, if a postbiotics is meant as an antibacterial material, you generally have to have your safe upper limits to be given. And whereas when it comes to prebiotics, there's no issue. Only in patients who have got irritable bowel syndrome, they can't take too much of prebiotics. As I showed that FODMAP foods, fructooligosaccharides and monosaccharides, etc. For those people, it is not recommended. For normal healthy gut, even if you take more prebiotic, at the most there will be some laxative effect rather than anything else. And as far as postbiotic is concerned, it's a very new science now. I can't tell you an answer whether there's an upper limit or a lower limit. We'll have to work it out and see. As far as probiotic numbers are concerned, you give higher number of probiotics, there's no harm has been reported so far, except in some unusual situations like what necrotizing enterocolitis or in acute injury of the gut. See, when your gut barrier is normal, any amount of bacteria will come out through the feces. But if the gut's bacteria is disturbed, then permeability increases and some bacteria can get into the circulation, and then it can cause systemic infection. Those are very rare. Otherwise, excess probiotic was not known to cause any harm.
Thank you, sir.
Yes, sir.
Thank you very much for the enlightening morning, and thank you that you traveled here and shared your presentation. Is it at all possible, sir, that your presentation, we could share your presentation, because the nuggets of great intelligence in that, which regrettably I couldn't copy while you were speaking.
Yeah, you can tell Dr. Prakash to share it with all the participants. I'll be happy.
I'll be very happy if you could do so, sir.
Yeah.
Thank you.
Thank you so much, sir. It was absolute honor to hear you. been following up on many things that NIN has been doing in probiotics and prebiotics. My name is Dr. Srilakshmi and I run a probiotic research company right here in Mysuru. Some of the things I just want to know on postbiotics. Yes, postbiotics has come into importance because of two big reasons. That the probiotics are neither temperature stable nor pH stable. But postbiotics should be taken more on the drug path rather than taken in the nutraceuticals, because the very difference, in fact, International Probiotic Association is fighting on it, that the very definition of probiotic is that this should go adhere in your stomach and should multiply on its own, so that over a period of time you are the problem which you are having will go away. And second best thing is that it will reboot literally your system, is what probiotic means in a easier term. Postbiotics are not those. It is just like a pharma product, except the benefit is you don't have a side effect. In a pharma product, we have side effects, wherein in the postbiotics, it is not, because it is a cell mass which has been, or cell debris, or killed, heat killed, or whatever way you kill. And you have those unfiltered, literally, product, which is supposed to give you because of one of the SCFAs or any of the metabolites that is forming. Do you think in the coming time, FSSAI will put it in a separate book rather than putting it along with the nutraceuticals? And actually people like us who are putting efforts, money, because when you're from a startup or a private sector, it's all your own money which goes into this research. So we get little bit of advantage when we say that our probiotics are doing, after obviously proving our efficacies and the preclinical trials on the rats or mice or whatever it is. Do you think in coming days we could, FSSAI would be actually putting these things differently rather than putting under the same banner called probiotic food, which is wrong totally?
Yeah, I agree with you. See, the whole thing depends upon the intent. If the intention of the postbiotic or a probiotic or even a prebiotic is meant to prevent, cure, treat, or mitigate a disease condition, then it's a drug. If it is not any of these four, then it's a food. This definition has also been gone up to the Supreme Court of India, and that has been presented there, and some drugs have become foods and some foods have become drugs and so on. So everything is dependent upon just that one definition, which WHO also endorses. So if you have, let us say, a short chain fatty acid, I was listening to an oncologist. They found when they give supplements of short chain fatty acids, the drug bioavailability of a chemotherapeutic agent actually improves. Okay, so there they are not giving it as a drug. There they are giving it as a facilitator of for the treatment. So there they are not either preventing the disease or treating the disease or curing the disease, and therefore it will go as a food supplement. But if the same short chain fatty acid is used as a adjuvant to a chemotherapeutic agent, then it will become a drug. So everything is based on only on the definition, and there will always be a battle. Right now we have a problem of vitamins and minerals more than 1 RDA in food should go to drug. So any product having vitamins and minerals more than 1 RDA is going to be regulated with the drug authority, not the food authority, because up to RDA is food, beyond RDA is drug. So that's the definition they gave.
Thank you so much.
Morning, sir. My name is Irfan. I've seen a lot of products which are sold in India under the label claim the drug. Most of the probiotics, especially the lactobacillus, we all know they're not temperature sensitive actually. And what under label claims people are putting in the packs and selling it across through the drug route, if you really take it and test it, 90% are dead, sir. Myself have done some studies recently, and what under label claim they put on the capsules, not less than 10 billion or something. If you really check it, it's hardly 0.1 million. So 99% are dead. So what kind of FSIC or drug people are not analyzing it and not checking any of these things, sir?
Yeah, this is a problem. This is a problem not only for probiotics, it's a problem everywhere. You know, any ingredient on the what is on the label is the amount which should be present at the end of shelf life. Okay. So, but when they actually pick the sample and do the analysis, they found it is much, much less than that. And that is punishable offense because you label claims are, legally you have to stay by that. So this is happening. I agree with you completely. But only thing is, in a vast country like ours with millions of manufacturers, some regulated, some not even properly regulated, that inspection mechanism can only be random. So systematically, we are not able to manage that at all.
Because we checked around 20 of.
See, this is a disadvantage to the genuine manufacturer, isn't it? So there's somebody who does a lot of hard work, produces a good product, does a clinical trial, and then some fly-by-night fellow comes inside and sells the same product with nothing in it. And he's able to market it because it is less expensive. So this is a problem for which I don't have any solution for that. And the inspection should be better.
Even the testing methods nowadays, this EU and
testing methods are likely to get simpler. But one more reason is many of these at the moment the measuring methods are a little more complex and expensive, and not all central food labs have the facilities. So now there are newer methods based on the genomic identification of this bacteria and also quantification, which will come very shortly. Like almost a point of care device, you will be able to take a sample and measure the bacterial quantity. Once that comes, it will be a lot easier.
Any input on the AFU or TFU counts on probiotics compared to what CFU counts are there?
CFUs?
No, there is one more which people nowadays are asking on. They want AFUs, active fluorescence units, and total fluorescence units on probiotics.
I have no
idea. If you go to EU and US, there are some clients. They don't want this CFU.
I'm not familiar with that.
Because when you do a processing of a fermentation on the product, when you do a drying, it may be a lyophilized drying, you get culturable cells, but they cannot be quantified. So they'll be viable, but not culturable. So keeping that in mind, they try to check the loads. And a lot of them are asking now instead of CFU, they ask the AFU and TFU.
But I think it's not part of regulation in our country. Viable bacteria.
Yeah.
Because we are actually quantifying the total bacteria, no?
Yeah, and
viable bacterial count.
And one of the questions NGPs, what sir was asking, they have one strain like Akkermansia, which has been regularly done, sir, and there is one already given GRAS status in 2022 by US FDA. So there are some 5 strains which have been in work now on almost at the stage of putting into the market now, sir, especially in the US. Thank you, sir.
Yeah.
I mean, it's been dead. Does the dead cells works as a postbiotic?
It may. I don't say it will, because it depends on several. See, there are several variables involved. See, not all dead cells are going to give that particular benefit which you're talking about. And when you're taking a probiotic, your intention is to improve the local gut health. But when you're taking a postbiotic, the intentions are different. So just because some are dead, that they will actually give the benefit, unless we study, we never know. Like I told about idli or dosa also, unless you look at the benefit which are measure the benefit which those dead bacteria are giving to the consumer, we can never say they will give a benefit. So if product is marketed as a probiotic, it should have live cells. And the definition itself says living organisms which are heat resistant, resistant to gastric digestion, etc., and colonize in the gut. Unless they fit the definition, a probiotic preparation can't be approved, and you cannot say that dead also will benefit you, and therefore it should be approved. No.
Thank you. Nice.
Thank you so much for the informative session, sir. My name is Ramya. I'm from Himalaya Wellness Company. So most of the companies now, they are using high CFU numbers. If you see like 60 billion, 70 billion, but unfortunately, they don't even mention this strain. So what's your thought on that? Like, is it using a right strain or using a high strength?
See, as long as they see now what FSSA wants is that particular bacterium which you are mentioning in your product should be there in the approved list. Okay, and even if you are not specific to the particular strain, if you are making a claim you should support the claim with appropriate scientific basis, either through published literature or through your own product testing. But if you have a particular strain, it is over and above the regulation. You mention your strain also, and then mention this particular strain is known to benefit in this particular situation. And that is how the labeling is supposed to be done. So if they are just putting the strain, but making a claim which is not an approved claim, it is wrong. Okay then. Thank you.
Thank you very much, sir. I hope all of you are benefited. Now, I request our director, madam, to felicitate the chief guest of today's event with a memento as token of gratitude. Thank you very much, ma'am, and thank you, sir. Now, I request our beloved director, Dr. Sridevi Annapurna Singh, to deliver the presidential address. Please, ma'am.
A very good morning to all present. I think you will agree with me that this talk was so wonderful by Dr. Sesikiran that there is very little left for me to say. However, I wish to congratulate the organizing team for this well thought out networking workshop that has been organized. Like our chief guest said, our gut is our second brain. And probably initially we did not understand its importance, and we started removing many things from our food to give a better sensory character as well as to improve its shelf life, until a lot of people eating refined grain products started getting colon cancer. And then it was thought it is because of the dietary fiber, and then we started putting back fiber, we gave it fancy names and so on. But historically, probably like rightly put, traditional foods had menu diversity as well as a lot of these components in our diet which helped us to maintain a healthy lifestyle. I remember my mother telling me that when they used to go to school, the leftover rice of the previous day used to be put in a mud pot, and it was filled with milk and a little bit of the culture of curd, and the next morning breakfast was this wonderful probiotic rice, which is today marketed in England as probiotic rice, but we have switched to breakfast cereals. And we have left that because it's not as glamorous, probably. So there is a lot of wisdom in our traditional knowledge. And after hearing what Dr. Sesikiran said, probably the simplest way to overcome whether it is our undernutrition problems or overnutrition and obesity and associated pathology problems is to go back to our traditional diets. And maybe to some extent we could solve this issue. So coming back to this a probiotic, of course, we knew if you look historically, cheese especially used, the milk used to be transported in leather bags and containers, and the bacteria as well as the enzymes that were a part of that curdled the milk to cheese. And this became the first fermented food probably which is recorded. But there have been many fermented foods in our diet that we consume, especially for a South Indian, a meal is never complete without curd rice. So we have also been consuming these foods when we are sick without too much of a complaint, because it's easier on the stomach also, including idli and dosa. These are foods that we have been eating over a period of time, and probably they have helped us without our knowledge. Then, like I said earlier, because of the lack of fiber, then prebiotics became very, very important. Today, postbiotics are taking center stage. And this workshop is about combining all the three. So I hope that we will get more and more insights into what is it that these small beings that are there in more numbers in our gut than the entire amount of human cells that are there in our body, and how they are controlling our life. I'm sure that this particular workshop will definitely give better ideas in commercializing also, because ultimately, unless the science comes out into the market and the consumer gets the benefit, we will not really realize what we have discovered. So coming to CFTRI, of course, a lot of work has been done. In fact, initial work on commercializing the idli dosa batter also, which has become a very common sight in all the supermarkets. It has been a work carried out over here. And I think recently we have been working on probiotic soy curd, as well as other bifido curd and so on, and even carrot nectars. So a lot of work is going on. We also have projects in collaboration with DRDO to try and find out how we can protect the healthy gut microflora in soldiers who are working under extreme conditions. I think all of us will agree, when we eat at food with our family and friends at home, we tend to eat more, we tend to eat better, it is tastier, and we are also happy. But the same food under stress conditions, the same recipe, doesn't matter, we don't like it. So our soldiers too are working either in extreme cold or heat and so on, and they seem to have issues. And we are trying to help to see how this can be done to mitigate the issues that they have in health. So the next time you are angry, the next time you are maybe sad, the next time maybe you have a fever, everything you can blame it on your gut probably, and try to correct it. In Kannada, there is a saying, Murti chikkadadaru, Kirti doddadu. Probably nothing fits better than to a microflora, which is invisible, but its fame and name is so huge that we don't need to look at it. I wish that this workshop will be very, very productive, and I'm sure with this galaxy of entrepreneurs, startups, and of course our knowledgeable dignitaries who are there in the front seats will put their heads together to come out with many tangible results. Thank you all very much. And once more, welcome to CFTRI.
Thank you very much, ma'am, for the inspiring and thoughtful presidential address. I request Dr. Sasikiran to felicitate our director with a memento, and I also request Dr. Prakash Halami to accompany. Please, ma'am. Thank you very much, ma'am, and thank you, sir. It is now time for a short break. I request you all to join us for high tea, which is being arranged outside the assembly hall. We request you enjoy your high tea while networking. The program will resume exactly back after the break, and all of you are requested to reassemble here at 11:30. Okay, the program shall resume at 11:30 sharp. Session is not even in this academic then he can be given லிங்க்னா வந்து இதுதான் கிளிக்கபிள் லிங்க் எல்லாம் கிடையாது நல்ல தெரிஞ்சு ப்ராசஸ் ಮಾಡ್ತೀನಿ ಅಂತ ನಾನು went for tea. Will stop it. There. Anyway, start take 20.
ಆಫ್ಟರ್ನೂನ್ ಇಲ್ಲ ಈಗಾನೇ ಇಲ್ಲ ಆಫ್ಟರ್ ಟೀ ಇತ್ತು ನಮ್ಗೆ ಗೊತ್ತಿಲ್ಲ ಸರ್ ಅಲ್ಲಿ ಇದೆ ಅಂದ್ರೇನೆ ಇವ್ರಿಗೇನೆ ಕೊಡಬೇಕು ತಾನೆ ಸರಿ ಸರಿ ಇವ್ರು ಕೊಡ್ತಾರೆ
Okay, sir.
And again, once everybody gets again, you can remind them, then you can start with the session.
Okay, sir. Yeah. Welcome back, everyone. I request participants who have registered for product display to set the table allotted in the quadrangle. Volunteers are present there to assist you while we continue with our technical sessions. Moving forward, we are pleased to have with us Dr. Ninad Pandit, Manager, Research and Development at Zytex Biotech, Mumbai. Pioneer in advancements in bacillus technology, probiotics, enzymes, and various biotech products. Today, Dr. Ninad Pandit will be sharing information about probiotic research in Zytex Biotech, offering us a glimpse into the innovative approaches, research advancements, and practical applications at Zytex. Please, sir.
Yeah, yeah. Hello. Yeah. Firstly, I thank Director Dr. Sridevi Annapurna Singh, Dr. Prakash Halami, CFTIR, and BioNEST for giving us an opportunity to present our company and our work at this prestigious college. This event will give a very good platform to interact with scientists, students, entrepreneurs, and industry delegates. In fact, I was fortunate to have yesterday evening interaction with Dr. Halami's scientific group, the students, and I was thrilled to actually see that they are working on many different innovative ideas in probiotics, postbiotics, and many other topics. And it was very enlightening to hear the suggestions and views of Shashikran sir. So it's been a pleasure and honor for us to be here and present. So through this presentation, I'll give you an overview about our company Zytex, what research we do in probiotics, and what commercial products we have come up for different application areas. So Zytex is an Indian company based in Mumbai, and our tagline is "Better Technology, Better World." So Zytex as a group of companies. We have a distribution arm called Arun and Corporation, which is the oldest company. We completed 75 years last year. And with respect to manufacturing, there are two companies, Zytex Biotech, which manufactures the probiotics, and Zytex Corporation, which is involved in chemical formulations for the textile industry. So initially we were more towards the distribution side, but in recent years we have invested more on the research and manufacturing. So these are the business segments. In Zytex Biotech, we do research on probiotics. Enzymes which we manufacture is nattokinase. It's a blood thinner given as a nutraceutical, and we produce a biopolymer called polygamma glutamic acid. Zytex Corporation, as I said earlier, is into formulations for textiles. And in the distribution arm, there is Arun and Corporation. We distribute products related to nutrition, pharmaceuticals, accessories for wines, making craft beer, coffee, yeast, which are specific for those applications. So we are into distribution and also technical. We technically support the customers on the products. So our R&D and head office is based in Mumbai. We have manufacturing plant in Baroda, which is the fermentation plant, and the textile application we have the plant in Silvassa, and our warehousing is in Bhiwandi. Domestically for textiles, we give products pan India, and for agriculture, the probiotics for agriculture, we are focused mainly on the central states of India. And with respect to all the products, we export it to North America, European Union, and Southeast Asian countries. Our R&D lab is based in Mumbai. It's a state-of-the-art facility, and it is DSIR approved lab from 2014. This is our fermentation plant in Baroda. So we have 3 plants in the facility because bacillus. We work on bacillus, and bacillus being have the ability to cross-contaminate between different strains. So having 3 facilities gives us the flexibility of taking 3 different strains at a time. The facility is GMP approved, FAMQS approved. These are some of the collaborations which we have with different global industries. So coming to probiotics, the definition given by WHO is probiotics are live organisms when given in adequate amounts give health benefits to the host. If we see probiotics, there are various microorganism groups. So starting from Bifidobacterium, Lactobacillus, Streptococcus, Enterococcus, yeast, these are all non-sporulating probiotics. Well, as Clostridium as a group, most of the strains are pathogenic, but the only one being probiotic is Clostridium butyricum. And all species of Bacillus, they are spore formers. So our focus right from the beginning was on Bacillus because it being a spore former, we all know that spores are very stable to environment conditions like heat, pressure, temperature. This gives actually the stability of the spore, which is the active ingredient in the final formulation, gives a very good stability to the final formulation. Because for probiotics, as we were discussing earlier, stability is an issue. Stability is an issue during the downstream of the downstream processing of the product and also during storage and transportation. Because the spores and the final formulations are stable, we don't need a cold chain to transport the products. They are very well stable on shelf at room temperatures. And if we consider application areas like agriculture, animal nutrition, wastewater treatment, where probiotics are used, we cannot have a high-end product in these areas. And definitely a product which needs a cold chain for transportation and storage would not be viable economically. So Bacillus being very hardy, it very well suits for these applications. So over a period of time, we have been doing many screening application specific screening programs to find novel Bacillus strains and develop fermentation processes for their bulk production. And for all our commercial strains, we have a stability of 2 years at room temperature. Also, the other advantage with Bacillus is that most of the strains are classified under the GRAS, that is generally regarded as safe status. So regulatory wise, it becomes easy for product commercialization and sales. With respect to manufacturing, we manufacture our own developed strains, and we also manufacture and do contract research for our client strains. I want to focus here a little bit on the strain, because if we see genetic stability, genetic similarity, I'm just giving them an example where humans are, they share around 98.8% of genetic similarity with chimpanzees and around 90% of similarity, genetic similarity with felines. Well, as if I consider, for example, Bacillus. So here I'm not considering, here I'm not comparing Bacillus subtilis, for example, with another species of Bacillus, say Bacillus licheniformis. I am just comparing 3 different Bacillus subtilis, strain 1, strain 2, strain 3. And we see that 2 of them share a very high percentage of genetic similarity, while the other 2 share a very low genetic similarity. So I want to basically focus here is that to study the culture, the microbe at a strain level is very important. It's not only the genus and the species, because just to give one more example is we ourselves, Homo sapiens. So Homo being the genus and sapiens being the species, but we all have different attributes. We all have different qualities. So it's the same with us. So studying the strain, the microorganism at the strain level is very important. For us, Bacillus being the product itself, the cell being the product, we cannot genetically modify it because that is not permitted according to the regulations. So we have to use wild strains. So the whole heart of our research is in strain selection. So what we have been doing over a period of time is we have done application specific screening programs. Just to give an example and elaborate on this, we initially ventured into the agriculture area, and we wanted some good strains having activity against plant pathogenic fungal strains. So we screened a lot of fields which were infected with different plant pathogenic funguses. So when we isolate soil samples, for example, from these fungus infected soil, and we isolate the bacteria, so the chances of those bacteria having some antimicrobial effects against those funguses are higher because they're already surviving in those infected conditions. The other logic is that if you screen from an area where you want to put back your product, so the chances of your bacteria surviving in the at the location of final applications are more, because your bacteria would have very good attributes for a particular application, but if it doesn't survive at the site of application, it would not do its function. So strain selection forms the basis of our research. Once we select the strains in the lab, we do study them thoroughly at 3 platforms. First is the bioinformatics. That genetic level we have to study whether they are safe, they have probiotic attributes, and so on. Then we establish their in vitro potential, and finally the in vivo results. So actually we narrow it down. So initially we have a lot of strains, and then while checking all these attributes, we select the strains which tick all the boxes. After the strains are selected from this screening program, making formulations is one more important part of the research. And finally, product quality and stability. These are also very important. So when the strains are selected, we also work a lot on the fermentation side, because again, a strain might have very good attributes as a probiotic, but if you cannot produce it in a commercially viable way, then that becomes the bottleneck. So what we focus on is, firstly, it should be a very high sporulating strain. Secondly, the spore should be heat stable, because we do spray drying as a downstream step. So what we typically do is, when we are developing the fermentation process, we take 2 counts, 2 viable counts. One is called a total viable count, and one is called a total spore count. So the total spore count, what we do is we take a suspension of the strain and we heat it at 80 degrees for 20 minutes. So the total spore count divided by the total viable count into 100 basically gives us the heat stability. And we work on only those strains which are showing more than 90% of heat stability. This is a typical flow which we follow from strain selection to strain commercialization. First is the strain isolation. Second is safety assessment. Third is the bioinformatics. Then the fermentation process development, field trials to establish the efficacy, because in vitro conditions and actual field conditions are very different. And unless the strain performs at the field, it will not give its beneficial effects for the final user. And then is the commercial part and the customer support. So just to give an example, we started screening bacillus for animal nutrition around 5-6 years back. So we did a lot of sampling from different, our focus was poultry. So we did a lot of sampling from poultry areas like soil, the litter, poultry feathers, poultry gut, and so on. So we ended up with more than 1,000 strains in the lab. And then we narrowed it down, like we found around 700 strains were safe. Then we looked at the fermentation traits, the strains having good sporulation ability, the strains which give high counts in the broths, and so on. And then we narrowed it down to gut stability, because gut stability being very important for a probiotic which is to be administered to the animals. Then gut adherence, antimicrobial properties, enzyme production is important for feed digestion, and then field trials. So from all this process, we ended up with 8 strains having very good attributes. So at the field trials, we have done several studies, and the parameters which we check is immunomodulation, the feed conversion ratio, which is a commercial parameter very important for the farmers, body weight gain, mortality, and ileal digestibility. So with respect to the fermentation process, once the strain is selected, we do a very thorough study at shake flask level to develop a media, because each strain has different media requirements. So even though it's a Bacillus subtilis, the yields are very different for different strains, all strains I can say. So we have some set medias and we do a lot of carbon nitrogen variation, mineral variation to get better sporulation. So a lot of studies are done at shake flask level, and once a media is set at shake flask level, we have small scale fermenters in our R&D lab. It's typically 15-20 liter fermenters. So there we take again several trials. We check for in-process pH profiles, DO profiles. We also have an in-process biomass probe. And once we get replicate results in terms of the final CFUs yields and also in terms of the profiles of the batches, then we go for the pilot scale, which is in our Baroda plant. So we have fermenters ranging from 100 to 500 liters. And once the process is set there, then it's ready for commercialization. So commercial fermenters range from 7.5 KL to 15 KL. For us, what is important is yield of the product. Yield is basically a multiplication of the quantity of product which we get from a batch into its CFU, CFU per gram. And what we check is again all the parameters which I just said. So with respect to application areas, we started with agriculture, then ventured into animal nutrition, aquaculture, wastewater treatment, and nutraceuticals is recently where we have started working. Again, for all these different applications, we have conducted different screening programs. So these are the different strains which we have commercialized. So they vary from Bacillus subtilis to coagulans, Bacillus natto, velezensis, and each strain have different attributes. For example, if we see Bacillus velezensis, which is ZBG17, it's a very versatile strain which does phosphate solubilization. It has anti-pathogenic properties ranging from anti-yeast, antifungal. It has very good properties to mitigate Vibrio, different Vibrio strains. It also produces biosurfactants. So such type of strains, we find applications over the different application fields. So it is used in aquaculture, animal nutrition, even agriculture. And some strains are very good in particular traits. So the final formulations which we make for different applications, it's basically either a single strain or a consortia of the strains. So we look at the properties of each strain and accordingly make the formulations. So for bioagriculture, we have a unit called Plant Biotics. Plant Biotics, the name comes from probiotics for plants. And here we have a basket of around 20 different products. Our key focus areas are biocontrol, bionutrition, and soil health. So in case of bionutrition, we focus on nitrogen, phosphorus, potassium, zinc, solubilization and uptake. Biostimulants, we work on different non-biotic agents like humic acid, fulvic acid, seaweed. So these, when incorporated into products having probiotics, they give a synergistic effect. Biocontrol, we have some very good strains, bacterial strains. For example, we have a Bacillus velezensis called ZB87 1/2, which gives very good antifungal effects for plant pathogenic fungi. It also has very good anti-yeast activity. So we are right now looking at using that in silages for silage preservation in cattle. And then soil health, and one more interesting project which we are working on is pesticide residual management. So we worked with NRCG Grapes Pune. So there basically what happens is before the grapes are harvested, before 20 days, they cannot spray any pesticides on the grapes. And that is a critical period where the grapes are prone to infections. So we try to spray our product. We have one strain which has very good antifungal effects. So we try to spray it on the grapes, which will protect the grapes from fungal infections. And we have also checked for the ability of the strain to degrade different pesticides which are used in the grapes. So both systemically and topically, because the strain also, when we spray it on the grapes, it also enters systemically. So it has shown a very good potential to also degrade the pesticides. So it gives beneficial effects on both sides, protecting the grapes from infections and also pesticide degradation. So we do some pot trials in our R&D unit in Mumbai, where we establish the products, and then further we do field trials. So we have around 10 acres of field in Baroda area where we do a lot of trials for our products. We have collaborated with many institutes in our research, like Institute of Chemical Technology, TNAU, NRCG grapes, and so on. Coming to animal nutrition, as I said, we also had a different screening program for this 6 years back, and our focus areas was disease control, antimicrobial resistance, nutrition, gut health, and farm solutions. I think the major issue in India in poultry is basically people using rampantly antibiotics as growth promoters. I think that is a very concerning issue. And probiotics, phytobiotics being the alternatives, and actually integrated management at the farmer's side is what is needed. But because Indian market is not regulated for not using antibiotics as growth promoters, it is really difficult to convince the farmers that probiotics is an very good alternative. But we have been working in that area. So we have formed we have a basket of formulations here. One is the pure probiotics. We have synbiotics, where we have added prebiotic and a probiotic in the formulation. Liquid probiotics, probiotics plus enzymes, and some specific formulations for some niche areas. Just to give an example, we have a product called Xenon AIP. This is for infections. So we have added 2 of our strains, that is Bacillus valezensis ZBG17 and Bacillus valezensis CGS 1.1. So both these strains have given us very good effect against multitude of pathogens at both in vitro levels and the field levels. For immunity, we have a product called Xenon IMU, which has Bacillus coagulans. So Bacillus coagulans produce lactic acid, and we have got good immunomodulatory effects with this strain. So I'll come up with some data in the slides, in the next slides. For diarrhea, we have a combination of Bacillus coagulans and Bacillus clausii. This has shown us very good results. Then we have a Xenon liquid, which is a liquid probiotic. It's a general probiotic having Bacillus subtilis and 2 strains of valezensis. This is the results for the Xenon AIP, where I said there are 2 Bacillus valezensis strains. So in the first bar graph, we see that it has activity against a multitude of pathogens, not only in poultry but pathogens like Vibrios in aquaculture and even for human pathogens. In the second photo, we can see that the activity we are checking against a standard Clostridium perfringens ATCC 3624 strain, and we see a very big zone of inhibition, which was very enticing when we were studying this strain. We also have 3-4 more strains having very similar activity. So Clostridium activity against Clostridium is very important because necrotic enteritis is a very enteritis is a very challenging infection in poultry. This is result of one of the field trials which we did on around 2100 male COP400 birds with this formulation. And we had used antibiotic growth promoter BMD, which is commonly used globally, as a positive control. Negative control was basically without any probiotic and neither the antibiotic in the feed. And what we see from the cumulative FCR after the trial and the body weight gain, that our probiotic formulation is giving results very close to BMD. So by this, we can convince the farmers to abstain use of antibiotic growth promoters and try for probiotics. The Xenon IMU, which is having Bacillus coagulans, has shown us very good immunomodulatory effects. So as we see from the data, it basically increases the expression of anti-inflammatory cytokines and decreases the expression of pro-inflammatory cytokines. This is basically a result for the same formulation in the field trials. So we have seen a higher humoral and humoral immunity and from using this formulation. Synbiotics, we have basically two premium formulations. So all these formulations, the CFU ranges from 1 billion to 20 billion CFU per gram or per ml of the product. So our whole intention is to give a product with a label claim of CFU, and as discussed earlier, that label claim should suffice for its stability period, which is 2 years. So after 2 years also, we should have that much CFU in the product, and giving the right strain for the right application. That has been our the heart of our research. In farm solutions, basically we have one development product called Terra S, which is a slurry baker. So usually in cold countries in EU and in North America, what they do is the cattle farmers, they store the cattle dung, they call it cattle slurry, in big tanks in the winter periods. And in the summer periods, they either use it for biogas production or as a fertilizer. But what happens is during the storage, it basically thickens and develops cracks, and it becomes difficult to pump it. And there are also challenges with the smell. So our product basically has probiotic microorganisms which are very good enzyme producers. They secrete different enzymes extracellularly. So when they are active, because cow dung is a very rich organic source, it's a food for them. So when they become active in that environment, they break down the proteins and the carbohydrates and the lipids, and they also keep the slurry in a liquid state. The odor problems are mitigated, and the final product is becomes more nutritious for to be used as a fertilizer for agriculture. So we are giving this product for a company in Ireland, and they're quite happy with the results. One more product is basically Odogo LM50, which is which neutralizes malodors. So this product is used in swine houses and in poultry houses where they spray it on the litter. So it has some odor neutralizing agents, but the bacteria work at the root of the problem, where the ammonia is produced from the excreta of the birds. So the microorganisms present in this formulation, they break down the proteins and the other micronutrients in the litter, and they prevent the formation of ammonia. With respect to aquaculture, the main focus area was disease control because of intensive farming, vibriosis and other. So for viral infections, definitely bacteria is, they don't work on that. But for bacterial infections like vibriosis, it's a very challenging for farmers. Pond water quality with respect to presence of ammonia, nitrates, H2S, that is one more grave problem for the farmers. And pond bottom managements and algal bloom. These are all the major challenging conditions for shrimp farmers in India. So we try to address those with our probiotic solutions. This is just a gist of different strains which we have screened for aquaculture application and the properties which we have studied. So activity against Vibrio, different species we have studied like standard 80cc strains. We have isolated different Vibrio clinical isolates from different infected pond samples, shrimp gut. And then we have checked them against these Vibriosis by agar well techniques, by log reduction techniques, co-culturing together. And the other traits which are important for probiotic in aquaculture application is its tolerance to salinity and pH, because pH quite a bit varies from region to region. And again, salinity, if you check, it varies from 10 ppt to around 30-35 ppt. So again, the probiotic culture might have very good attributes for aquaculture, but if it doesn't grow well in the environment where you're putting it, then it will give its limited potential. The ability of the cultures to break down ammonia, nitrates, and nitrites, that also we have checked. And basically, the strains, ticking all these boxes, we have finalized those strains for the commercial formulations. So these are the different product range which we have for aquaculture, ranging from gut health to pond remediation. We have a specific strain for vibriosis, where it's a consortium of 5 different bacillus strains, which we found having the very good activity against different vibrio strains. Coming to wastewater, what we found that it's very challenging, because wastewater is divided into STPs and ETPs. So ETPs is not that of a challenge because the organic load is same everywhere, but ETPs is a very challenging area because the upstream is very different from industry to industry. And when we started actually checking commercial probiotic or biological products having microorganisms, so we found that the counts were very less. They were not, and most of the products in wastewater, they don't even have a label claim for the probiotic. So our aim was to give the right probiotic at a very high concentration, because when we actually checked many commercial formulations, the CFUs were ranging from 0.1 billion to 0.5 billion per gram. But if you see products from companies in US and Europe, they give a label claim of 5 billion, 10 billion. They also have label claim for added enzymes. What are the units of those enzymes? So we had that approach of giving the right CFU and the right strain. So again, here we have a bunch of products, different products for BOD, COD, different products for FOG, which is fats, oil, and grease. Then STP, we have a different product. For dye degradation, we have done a lot of studies. The cultures which can degrade dyes, because dyes are very difficult to degrade, especially the sulfur-S dye, and some other dyes have complex structures, many aromatic rings are there. So that's a challenge, but we have found some very good strains in these applications also. These are some of the publications and patents which we have got over our research period. So again, thank you very much for giving us an opportunity to present here. Any questions, please, please. Yes, sir.
Happy to know that Zytex is.
I would like to repeat the participants who are participating in product display to set your products in the quadrangle, and let us keep the interactive session short as we are running short of time. 1 or 2 queries may be addressed here. I request all the other participants to interact during product display session. Thank you.
Happy to know that Zytex is working more on bacillus. So I have 2 questions. So when Zytex is working more on the environmental isolates, the major challenge will be the resistance that these isolates possess, either intrinsic or plasmid borne or genome encoded. So how you guys proceed with such isolates? And the second one is again the genome variations that you have showed, like few strains will share similar identity and some of them will not. And I guess such differences will be mostly because of this MGEs, mobile genetic elements. And if such cases, these elements are known for producing such few toxins by themselves. So in such cases, how you guys proceed with those formulations, and also about this oxotrophic nature of this bacteria will make another challenge to culture them in a bulk quantities.
Right.
So how Zytex proceed with those isolates, or how do you manage these guys?
Right. So as we work on wild strains, they are known to mutate. So culture preservation is very important. So what we do is we have a mother cell bank for each strain, which remains constant. So we have two sets of vials, basically the cryo vials which we make. One is the MCVs, which is the mother culture vial, and second is the WCVs, which is the working culture vial. So whenever we take a campaign for a particular strain, commercial production of the strain, we prepare these working cryo vials from the mother culture vials. And we don't passage the mother culture vials. So basically we go to the same source, because when you passage the strain, it might lead to some random mutations. And because we have the whole genome sequencing data for the mother culture vials, so we know that whether it produces any toxins or it doesn't produce. So that covers the safety aspect. So that we have already checked before commercializing the strain. And basically, it's the culture preservation which is very critical here. Right? Yes, sir.
Take it to commercial.
Right. So once we do the isolation, before actually going for the screening, we have to apply for the National Biodiversity Board and the State Biodiversity Board. So we have to fill those forms, and we have to get the approval. And then once the product is commercialized, we have to give a percentage of royalty from the area where we have screened to the local community there. So that we are all following.
So the royalties for one time or until the product
Royalty
is in
is continuous. It's a part of your profit, a small part of your profit.
Oh, yeah. Thank you.
Yes, yes.
So if you have taken the strain from any of those banks and if you have worked on it, do still the royalties come in place, or is it that?
I actually we have not commercial any of our strains from a bank, but I think if we do that, we have to buy that strain probably as a one-time charge. We have to pay for the bank and then we can produce. I guess it is later. I'm not very sure.
Oh.
Good afternoon, sir. Sir, it's a very diverse range of portfolio and congratulations for the work.
Thank you.
So what I want to ask is that we were having discussions about the strain specificity of a certain probiotic bacterium.
Right.
Okay. So when you see from a fermentation standpoint, what are the challenges you have faced in producing a strain specific culture or like a generic culture, which is just going by the name of the genus and the species?
Right. So when we develop medias for different strains, as I said, each strain has its own characteristics to grow in a particular media. So it's not like when we do on a shake flask in a lab for testing the properties, we use MRS for lactobacillus, for example. But when we produce lactobacillus in a commercial scale, we cannot use MRS. So there are many challenges because some of the strains, they don't go into sporulation. There was one Bacillus subtilis strain which was going into sporulation with the media which we selected at a shake flask level. But when we tried at the fermenter level, it was just not going to sporulation. So we took around 60 batches. We fine-tuned the parameters and then finally we got sporulation there. So though Bacillus seems to be easier microbe to grow and sporulate because it's a natural sporulator, but there are many differences from strain to strain. So some are very easy. So they quickly sporulate. Some have challenges of sporulation. Some have challenges of very low CFUs. So they don't express well on the synthetic media. So if you choose that strain and try to commercialize it, again, we have to work a lot on that.
Sir, also from a production perspective, how much is the difference in cost in producing a strain specific bacterium? Like how much scale, like on what scale is the difference between a generic strain and like a strain specific culture?
So generic strain, again, I mean, you mean to say that you go with a traditional media or something like that? I mean, you want to say,
Yeah,
so
yes.
so basically, if we see, if you're producing a generic strain using a generic media, it is usually more costlier because what we use in the commercial fermentation, majorly the carbon source and the nitrogen source. The nitrogen source is the costliest compound of all the raw materials, and we cannot use. Bacillus usually do not assimilate synthetic nitrogen sources, so we have to use organic nitrogen source. And usually the peptones or yeast extracts, a combination of these suffice. But because Bacillus has spore formers during downstream, the downstream is not that costly because we just have to do a solid liquid separation, either centrifugation or a microfiltration, followed by spray drying. The spray drying is intensive, so it adds cost to the whole process, but it is much cheaper than lyophilization. So basically, the production cost we try to keep it down with Bacillus.
Thank you, sir.
Thank you very much, everyone. And thank you very much, Ninad sir, for your presentation. Your talk has given us a very insightful values on how. Yes, sir. Okay. Without any further delay, I would like to call upon Dr. Sri Lakshmi Desiraju, CEO and co-founder of AA Probiotics, Mysuru, to share her knowledge on the topic, new developments in probiotic application. Please, ma'am.
Pointer back. Sure. So good afternoon, everybody. It's 12:15. I'm very sure all of you are awaiting to quickly wrap up this session and get on to the gut food that is waiting for you guys. And there are two of us, me and Kumar, who are going to be standing between the two. So would like to take you through this journey, very detailed, but very quickly also. We heard in the morning Dr. Sasikiran's talk. We heard after that Ninad's talk. We heard, and I'm standing in a place which is which writes the holy grail in research of food and my area, that is probiotics. So it's not that I have to teach something here. If I'm teaching or if I'm trying to tell you something here, then it is like preaching choir to the church. They know better than me what exactly happens. So what I'm going to do here in next 20 minutes, because this whole thing was a networking event and to bring entrepreneurship. Okay. Science is there, obviously. Without science, we cannot survive. So science is there, but I'll show you how this technology product innovation can happen from the technology, because I come from the startup world or the industry. Very happy today, actually. Incidentally, I did not know this, but very happy that this is my second and the third company that I'm going to talk about. But my first company, which was my first baby, Triphase Pharmaceutical, was because of one person whose brainchild actually we made a product out of it, who is there in the audience today. And I'm very thankful to you. That today I'm able to talk about your work as a scientist and make and see, everybody can see that how a science can be turned into a product of use or commercialization. Now, second happiness is because the current team, both at AA Probiotics, who makes, we make gummies there, nutraceutical gummies, and probiotic gummies is one of the strong point for us. They are here. And the second part is Probiotic Innovations, where we work into hardcore probiotics that in the morning Dr. Sasikaran was talking about, that which are the areas people are working in. Sir, we do work in gut-brain axis, autism, ASD, gut-skin axis. We also work very heavily in the area of bioremediation, which Zytex just talked about. And we also work in the area of gut-liver axis. So there are few of those things. So science is not what I'm taking you through right now. My slides are telling you how to take the science and convert into products. Because very rightly, Dr. Sridevi had told us in the morning that unless you convert into technology into commercialization, there's no point of doing that technology, right? CFTRI is all about it. So taking you through some recent advances, some of the things we are doing ourselves. So I'll put it there, and some of the things which the world is doing, which I really appreciate, especially with Zytex. I heard, sir, how you took that Bacillus species all the way to 8 from thousands. Believe me, Saccharomyces boulardii, similarly we did from 3,152. We came down to 3,000.
There were only 3 of them which were active. So all the other things went in the drain actually. So when you do want to become a entrepreneur, there are a lot of things on the call, because here nobody pays you this money. This is your own self created wealth that you have to put it there. So you do not have a choice of becoming a failure. It's as simple as that. Right? Because if you become a failure, it's not like 3 people and 4 computers who will write what sabji you're making next door and make money like Facebook. It is about actually putting money right up front, 1 crore of it, to start a lab. And so it is very, very difficult to understand how to maneuver your way so that you can make something happen of importance. So as we go into the introduction, definitely gut microbiome, gut microbiota, gut microbiomes, probiotics, all these things have become the keywords. Some with the help of your Instagram, some because of Facebook, some because of all the social media talking about. The page 3 crowd actually comes and tell you how gut microbiota helps in living a normal life, where I don't understand sometimes, but then they are the people who pay you. So I definitely visualize their life. And when the society has people like Deepika Padukone, who comes on the national TV to tell you that I fought depression, believe me, I get into depression. I am like, God bless you. You have the money, you have beauty, you have a beautiful life, and you were born with a silver spoon because you are Prakash Padukone's daughter. It's not like you came from the start finish. And you have a husband who's earning very well and doing good, and now you have a baby and you fought depression. God bless you. We all should be highly depressed then. But then there is a problem that we don't understand, and I did understand this problem, especially because some of our products actually goes to these Bollywood celebrities. So I have some bragging rights on it, and I realized that their routines are very horrible. 2 o'clock in the night, if you have to do a dance number, neither your sleep is there nor your food is there. You have to maintain that 0 figure. You have to have a glowing skin. You need probiotics of all kinds actually. So that is the reason we realized that probiotics have gone beyond scientific measures. These have gone into normal people's tables and normal people's health, habitual life. So we have to take some of the things as research, some of the things as clinically validation, and that's why I asked you, sir, that whether you have worked on some of the strains which can be bought from outside. Everything as a startup, you can't do everything from carbon, hydrogen, nitrogen. So that is the reason I asked, when you buy it from outside, does it? Because for isolation and doing all these things, that itself is a PhD topic which Dr. Halami would like to talk about, I think so. Why gut health matters. Just a little bit of introduction, and then I'm not taking you through that. Because it just not affects your digestion, it affects everything. It affects your digestion, that is the bare minimum. It affects because gut and brain are connected, as simple as that. You have diarrhea and constipation, your brain doesn't work that day, your productivity is down. You have anything fluttering in your stomach that day, right from your exams. There are audience whose kids might be giving exams. Kids are not studied. Your stomach is going to flutter. There are young boys and girls. They have breakups. Their stomach will have butterflies. Either way, you are not able to perform. So both ways, whether it is the gut to the brain or brain to the gut, it affects. It affects healthy skin. If your gut is not well, your skin will show, that will be the first sign to show where your acne are coming. And it is equal for boys and girls. It doesn't matter. Dysbiosis is same, whether it is for boys or girls. Girls are more attentive to it, but boys also have. The acne is coming under the eyes have a different significance. The acne is coming on forehead, or pimples coming on forehead has a different significance. And you can actually see, which in the next lecture, Kumar is going to tell you how these personalized things can be identified and told that why this particular problem is coming to you and which bacteria is missing. It affects sleep. We underrate it. We take pride in saying I sleep only 4 hours. It's no fun. Believe me, your body requires a circadian rhythm. Unless that whole body is given rest enough that your body is able to perform next day, it requires that overhauling, and that is where the gut health is very, very important. Not to say the least, the mental health. I have mental fog. Young boys and girls come and tell you have mental fog, and which you don't understand. We didn't know what mental fog was at their age. And these all are coming because what the food you are eating and how your gut is affecting and how you're doing day-to-day life is what the reason that your sleep is getting affected. And not the last but not the least, your immunity. That has become a key word for all of us because of COVID. During COVID, we said we did not become sick because my immunity was good or my immunity was bad. So that is one thing that the gut definitely affects. So gut health matters. It could be as simple as this. Your stomach is upset. There is an infection. Infection untreated for some longer time, inflammation. Inflammation untreated for longer time will end up into the further action. Sometimes some of these cancer cells get activated. For us, we have to go through some steps. When you are a biotech startup, there is something called value of death. Value of death is where your passion goes to one say, as just now Ninad said, how they take it from shake flask all the way to the fermenter, higher fermenters. Your passion could be ending up only at the shake flask level. After that, you need a lot of money to go to the next step. So there is a place where it is called as value of death. So what we do is we do multiple things, and these are the steps. If you are wanting to become an entrepreneur, maybe this might be the right thing to note it down. Number one, identify the market pain. What exactly are you trying to solve? Number two, do you have a solution for it? Number three, please do a market analysis right at the beginning, because you do not know whether that market wants it even or not. Concept selling is not fun. I have done it in my first business at Triphase and I know how difficult it is. Number four, if at all the market is scalable and you can see that there is a benefit of doing all these things, please go ahead and do something for protecting your IP. Number five, which is the most important, please make something called go to market. That is, how are you going to take this technology and going and commercializing in the market in the form of product, in the form of services, in the form of which way are you going to do it? If you are able to do this sequence, there is a high likelihood that you will be successful. If you are not going to do that sequence, then the very first crore that you or million rupee that you have invested into that company is going to go down the drain. It's a circular downward spiral turn in biotech. Take this as a golden line in your heads. So your GTM or go to market strategy should have been clearly written down. What is your exit strategy? What do I mean by exit strategy is when you know that this technology can bring you 100 rupees or 500 rupees, between 100 to 500, if I get 250, I am ready to get out of this technology, because otherwise you need a company like Zytex who can take you through and make it happen to the world's level. They are in the business with so many divisions after so many years. It's a dream come for an entrepreneur like me. But to be truthful to you, at your age, at your time, when you are starting, you need to know when to exit. If you do not know, then there is something called positive toxicity. You think everything will work, but nothing works, and you will go down so badly down the drain financially that you will not know how to come out of it. And we all have gone who are standing on this side of the stage and talking to you about it. So maybe you do some different mistakes. We have done our mistakes. Please don't repeat it. So this is the reason we do this step called market potential. We first find out what is the market potential. Is there anything that we have done? And if that is something that the market can approach, and which are the formats that the market will take, please spend time or hire somebody to do it for you. So as of now also the ingredient market in the probiotic is high. Everybody wants to make an ingredient. Baba, tum final product aap log banao, because selling the final product in FMCG or in D2C market is very difficult. right? You need a lot of money. And for us to spend that kind of money, you need investors' money. And if you take investors' money, then basically the investor is driving your company. So there are lots of ways that you can do it, but definitely we are very happy to see that there are lots of opportunities, but you need to know where to spend your money. There have been recent scientific advances, which I don't know, this is not working. There have been recent scientific advances which have been very, very interesting. We have gone between non-spore and spore formers. Yes, spore formers are stable. And thank you. We have gone beyond non-spore and spore formers, and we are looking at new species now. Why? Because finally we want to show that there is a science and there is a clinical validation to it. So it's not just about prebiotics, probiotics, and postbiotics. There is something called parabiotics. There is something called between biotics. But these are all the things which are required now as this science is growing. One of the talks you will have after my talk is precision probiotics based on microbiome profiling. This is something which has come new, and I think it is so simple to understand. In your own household, if you have eat the same food, 4 people are digesting differently. Not everybody is able to digest the same way. So obviously you need to now to take care of it and say, is this the bacteria which is missing from me? Where does this bacteria actually come to you? This bacteria, you are born with a sterile gut. So the bacteria comes to you when you are born, either through C-section or through normal birth channel. But apart from that, the first set of bacteria which gets into your system is through mother's milk. As sir said very rightly, that you have prebiotic as HMO, that is human milk oligosaccharides. Those are the ones that the child actually, those bacteria, bifidobacteria, they eat it. And if you remember, when the child is born and when you're feeding the child, after that, the parents will keep the child on the shoulder and move 4 or 5 times, walk 4 or 5 times, because the child has to eat that prebiotic, digest it, and give a burp for you to say, okay, I'm ready to sleep. But that whole process is a gut microbiota working in behind. Right? So this is where you need to understand that there are different areas that we have to work. But the most important are some of the new areas that is, and Akkermansia that we spoke about some time back here. Akkermansia is one such probiotic now that we are looking at very seriously. Why? Because the basic thing which these probiotics do is they make something called postbiotics after eating prebiotics, which strengthens your internal gut lining. If your gut lining is strong, then the condition is called as a happy gut. If it is not, then it is called as gut dysbiosis. And once the gut dysbiosis happens is when you start to get into trouble health-wise. So this is the reason why we see that why we have to find different SCFAs or different other products, different postbiotics, which can keep the gut lining very strong. And Akkermansia actually gives something called mucin, which is right there in the gut lining, which actually strengthens. So there's a lot of work which is happening in Akkermansia, and it is another one big, hopefully not another probiotic, but actually a probiotic which gives you some sense. Technological innovations. I can come up with a whole bunch of strains, but that doesn't give you the benefit of understanding what you want to do. Not that it is not important, it's very important, but just that I'm telling you what all things happen. First and foremost, we still have the problem. The reason somebody asked question why we add 60 billion or 50 billion in the European countries and North American countries. FDA says you require 1 to 5 billion CFU per day. Why do you add 60 billion or 70 billion or 120 billion screaming on the bottle? Because your probiotics are neither temperature stable nor pH stable. ज़्यादा डाल दो, बड़ी बड़ी बात करो, so that the consumer who is not able to understand the science behind it will pick up the bottle. Oh, this one is giving for this much only 2 bacteria with 20 billion or 10 billion. This one is giving 120 billion. ये ज़्यादा better है. In India, it works very nicely. The moment the price is less, you can sell anything, anything. So the science goes out of the window. And that is the reason we needed to see what was it. And as I said, I'm really happy that I have my ex-colleague here who was the brainchild behind something that we did at Triphase Pharmaceutical, where we said, okay, can we take a bacteria? And the main market pain is that it is neither pH stable nor temperature stable. Can we take this natural bacteria and can we make it temperature and pH stable, keeping our handcuffs that it is not going to change genetically and we are not going to micro encapsulate it. And we started on a journey in 2011. Wherein in 2016, the Eureka moment came. And that's why I said that when you have a probiotic or a biotech company, you require a lot of understanding as to how to take it forward. Second technological evolution is controlled release delivery systems. Controlled release, that is another fad which is coming up, which says slow motion delivery system. For slow motion delivery system, what is happening? You are doing some encapsulation there or something, some process there. Now this process has to get into your gut. It has to open up, release the bacteria, and then the bacteria has to do its job. Right? Adding cost to the whole process. Right? Fermentation and bioprocessing advancement. Yes, these are some things that we also looked into, and very happily to say that some of these probiotics which used to take 48 hours or 38 hours were reduced to 14 hours with a good CFU count. And the strain selection and formulation, as you rightly said, Ninad, that you need to know why you're taking which strain. With all these things kept in mind, in the first company at Triphase, we addressed this problem that can we make these probiotics temperature or pH stable? And very happy to, why it was important. This was the market pain. As I told you, there are few things that you need to understand. These were the market pain because the medium of consumption was only dairy based. Even today, you get only Yakult in cold chain. You get Amul ice cream in cold chain. You get Dahi and Milky Mist Dahi in cold chain. And so these bacteria are added to this. And you say, okay, fine, I am now a probiotic company without really addressing the main problem. What happens to those people who are lactose intolerant? What happens to those people who cannot digest milk and products? Bhai, probiotics unko chahiye. They need it more than any one of us. And you are telling me that since I cannot put it in without a cold chain, so I'll just put it in these things. And Baba, you eat it. If you can live through it, live it. If you can't live through it, then you find a way to do it. So dairy based was not, this is how things are there. And other than that, we said, okay, fine. The problem which came along with it was, first and foremost, limited applications, manufacturing complexities, restricted label claims, high overages. This is what was the problem in the market. And we said, how can we solve it? Well, we were able to do that very successfully. And we were able to make these bacteria, again, it is stuck here. And we are able to make these bacteria both temperature as well as pH stable. Took us 6 years. But it got us this USP, that is unique selling proposition, wherein we brought the product stability, wherein we brought the 12 months stability on the product, on the life cycle management, wherein we brought the supply chain, we reduced the cost of the cold chain, and also we improved the label claim. Even today, when you go to foreign countries and you buy probiotics from there, you see the label claim saying at the time of manufacturing. They don't say at the time of eating. Means as soon as the van went out of my company's headquarters, I am not responsible for anything. Right? We spoke in the morning, sir told label claims are important. But where is the label claim? At the time of manufacturing, it was there, boss. I don't know what it is now. And it was non-GMO. We did a lot of GMO studies to check that it was not there. So a couple of these things we did. And one of the things that we were successful making was the gummy format. There are other formats which are there in the market, but as at Probix, we were able to make it into the gummy format. We were able to make it in chocolate formats, and to a large extent, we also did a little bit of the dairy, the bakery products. This is one of the formats that we sell. That is the gummy format. Now, apart from this, we also did another thing. Sir said, or Madam said about the armed forces people. They live in -60 and they live in +35, +50. -65 in Siachen Basin and as well as +50 in Rajasthan. And the first thing that goes bad for an army person is stomach. Because -60, they'll eat only canned foods. So actually, after 3 months, when they are given duty of 90 days, both my business partner as well as my own brother, they both are from armed forces. So I see them having this problem. So these people, when they come out from the Siachen Basin, since they have been eating only canned foods, they go into IBS and IBD problems as soon as they come out from Siachen. +50, you know what it is. I'm coming back from Andhra, and that's why I was not there here early in the morning. Believe me, it is 42 to 45 degrees. All my gut bacteria were jumping high and low. Coming back to Mysuru was just a heaven. My gut bacteria also kind of relaxed. Otherwise, I was just jumping high and low. So even the heat affects the gut bacteria. So anyway, the cap is formed where we put all these 4 products inside there, the prebiotic, a probiotic, sugar or a sugar free if they want, or it becomes like a rasna actually. And this cap is a universal cap, goes on any of the product, any of the bottles. You just press it, push it, shake it, drink it. And again, as I said, I'm really happy that one of the colleagues is here, and these are all his brainchild that I'm showcasing. Yes, products are in my next company, but the brainchild, the science, the thought process were his. Pharma applications. We did some of these things wherein we realized one thing: enzymes and probiotics, if they are mixed properly, if the combination comes out 2, 1 + 1 doesn't become 2, it becomes 11. Serratiopeptidase with the right amount of probiotic and the right strain actually does wonders on inflammation. So we had some of these probiotics in the previous company, and the advancements that I was talking about is now the personalized probiotics, where we are doing a gut microbiome testing, which actually Kumar will give you a detail just after my talk. And then from there, we make personalized probiotics, and we do it with diet management. Another area that these probiotics are very useful, and I think, Ninad, we really need to sit and talk about, because a lot of points are common for both of us, is in the area of aquaculture. So again, the same thing, market pain. Market pain of aquaculture is that you get protein and protein source only from your fish, right? Omega-3 comes from the fish, right? But you are eating fish from what? The ponds, the rivers, and the oceans all are contaminated. So what is the market pain? That you want to eat the fish for its benefit, but there are no benefits coming because you are also getting all the chemicals along with it. With this, we started working in this area. And this is a real very small R&D tank that I made right in my backyard. But we came up with a consortium of bacteria, which we scaled it up at commercial level actually. We came up with a consortium of bacteria which actually, when we start the flock, it's called bioflock. It's not, again, not my great this one. There is a Israeli scientist who has actually started it, but yes, at least in India, I know for sure that I have done some addition to it, and we have made it really big in a very different way. So this consortium of bacteria, of course, are our own isolations and findings. And with consortium of bacteria, we actually create these tanks. We do the fermentation in these big tanks, 18 feet by 14 feet by 4 feet, 22,000 cubic liters of water. And after 3 weeks, we add fishlings to it. Fishes eat, and for fish, we add soybean. So this fish eats soybean, gets its protein, it starts to grow. The excretion of this soybean, the fish becomes the food for the bacteria. So in situ, there is a cyclic thing which is running. And what happens is that The bacteria controls the water quality, the fish eats the bacteria, the digestion is good. Again, the organic waste is recycled. Every 10 days, 4 liters of water is sent out to the fields. And Ninad, I can tell you this much, that at least my home garden has on the vines tomatoes ripe in red color without infestation of any kind of infection for good 30 days. Because this water contains high amount of ammonia or nitrogen fixing bacteria. So we made this tanks and we started using probiotics in this one. And the thing which I added to this whole technology was when I went to the banks to give the farmer the loan, they said, we will not give, it is agriculture. What the farmer does, we don't know. Plus technology is not proven what you will do. Literally, we have Infosys right here. Infosys, 4 Infosians were getting out of Infosys. And the first thing Infosians, when they leave the Infosys, they think they should open a restaurant. And I said, don't do that. So they said, then what should we do? I said, you have learned so much of engineering. Please help me do something. And they created something called IoT. Internet of Things, where they created all these small pH for measuring pH meter already was there, of course. For temperature, there was a this one. So there are 8 critical parameters to take care of this tank: the dissolved oxygen, the pH meter, the temperature, the nitrogen, ammonia, the nitrates to nitrites, the TDS. Yeah, and a small camera to see that the fish keeps moving, because if the fish doesn't move, then it is not going to eat. If it doesn't go eat, it becomes a midget. It doesn't grow in size that we want to. So this is something that we added to it, and through the controlled way, we put it on the cloud. Today it comes on my computer showing whether the pond is working or not. If it is a green color, my farmer is happy. If it is orange, he picks up the phone and calls us. If it is a red color, we actually run to save his farm. This is the output. 700 to 900 kg, 1.3 tons of fishes every 6 months. So that is the way you commercialize the technologies. Again, another of the current team, one of the employees, she was the real person who went behind it and made it happen. So what are the opportunities left for us? I can go on, and I've been told to finish it in 2 minutes. So the opportunities which lies ahead of us in India, not with Trump having all the tariff problem. Let us talk only about India. We are 140 crores. If 140 crores, 10% also eat, you and me will become rich. Let us focus only on our people. If Trump finds that his gut bacteria are going wrong and he needs our bacteria, then we will talk about biodiversity then to him in his language. So Ayurveda is one big thing. We cannot relegate it. When I came back from Canada to start my company in 2009, I didn't go to Ayurveda only for one reason, because we still were thought about as a snake charmers. Now this had nothing to do with the science, but then these are all the things which affect a company to grow or go totally dud. So Ayurveda is something that the probiotics and Ayurveda should combine. Then there is another gut-brain axis where we are working very heavily onto the neurotransmitters which take the serotonin uptake and different things specific for a specific disease area. We also are looking at how we can tag along with BIRAC and other granting agencies to take us forward. This is one of the innovations that at Probiotics Innovations we are working, sir. We are working on autism spectrum disorder. And that's why we are seeing that in autistic children, the pattern of the bacteria is same. Prenatal, natal, going forward, up to 6 years of age, both in US and here, we have taken some data of these bacteria. We see that the same set of bacteria are being repeated there. So that means if you have identified the problem or market pain, the solution has to be there. And that's why our team works here. Other area which we are working up, of course, in this people are working. We are not the only one, and I'm happy because somebody is working. Because if Yakult could come, Yakult came into this commercialization in Japan in 1935. It came to India in 2006. From 2006, it has been giving one-page ad in Times of India, and still in 2024, it doesn't even sell 20 crore bottles a day. So you can imagine how things are in this country. So it's always good to have somebody also along with you. Competition is good. That is my mantra for us to be successful as a company, not as a researcher. There are few products which are there in outside the country, and these are the products which are for this, specifically for maintaining some of the symptoms of ASD. Then we also at Probiotic Innovations, we work in the area of gut-skin axis. Skin is another area that is very, very important because skin also has that same length. And in fact, skin is outside. It is more prone to any of the problems rather than inside. We also work in bioremediation. We address a lot of things. One of them is oil spills, heavy metals, pesticides, industrial waste. Again, the same thing. Not that we are become thinner as we are making many areas to work upon, but the idea is for us to survive as a company from the startup to micro to medium size. You have to work in multiple areas. One will strike and you will make your money. And these are some of the things that, so every in each of our project, the first thing is to find market pain. The second thing is to find solution. But before that, we do market analysis so that we know that we are on the right path. Thank you so much. I'm hoping that it is of interest to you because it is not high science, but at least the science which can be converted into commercialization. Thank you very much.
Thank you very much, ma'am. Your talk gave us insight into the latest trends, technologies, and possibilities in the rapidly evolving field. I would now request the dignitaries and the participants to visit the interactive product display session, which is arranged in the quadrangle, wherein different products from startups and CFTRI participants are displayed. Hope this session provides you an opportunity to see, understand, network, identify, and collaborate with the potential industry academia partners. Also, there will be a group photo session which will be held near the main building of CFTRI at 1 p.m. sharp, after which there will break for lunch at 1:05. The lunch is being arranged at IFTTC mess for those who have registered on a self-pay option. I request all of you to reassemble at IFTTC hall exactly at 2 o'clock after lunch, and we would resume the program. Thank you all. Ma'am, now only. Okay. Participants, just a minute. I request Dr. Prakash Halami to felicitate Dr. Ninad Pandit and Dr. Sri Lakshmi Desiraju.